Hello, welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, I am joined by Autumn Glover, who serves as a government affairs and community relations consultant at Wexner Medical Center, which is part of The Ohio State University in Columbus, Ohio. Hello and welcome.
Thank you so much.
Well, I want to start off with just kind of finding out how are you? How is today finding you in our current state of affairs?
I'm well. Never a dull moment here at Ohio State. So doing a lot of great things in the community that I hope I'll get to highlight today in our conversation.
Definitely. And speaking of the Ohio State, you spent quite a bit of time there. So tell us a little bit about what got you interested in urban planning, and then how did you get interested in the health equity aspect of urban planning and development?
Sure. So I am a Buckeye through and through. I always tell people there's nothing that you can do at Ohio State that I haven't done. So I went to Ohio State for undergrad and graduate school. I had a baby there. I worked at the university and the medical center. So I really do love Ohio State and all that it does for our local community and for the residents of Ohio at large. When I came to go to school at Ohio State, I thought ultimately I was going to go to law school and then I would work in community development. I didn't even know that city and regional planning existed, and certainly did not know that it was born out of public health. And so as I was preparing to graduate school, I applied for law school, got in, was going to go to law school and work in this space. And something in my gut said, keep thinking. And I think, everything in life, whether you're a person of faith or not, time and opportunity meet on an axis. And I always say my entire life is a function of God just having his thumb on my head, like, okay, go this way, go that way. And so when I was thinking about law school, it just happened to be that the chair of our city and regional planning program at Ohio State at the time was also a law school professor. So I went to go meet with him as I was preparing for law school, and he said, everything you're saying, I think you need to go to the School of Architecture, which was a big building on campus that I just walked past throughout my undergraduate career. And so long story short, I took his advice. I took a class in planning and immediately was like, okay, these are my people. This is where I'm supposed to be. Most people who study planning end up going to go work in an architecture firm, go work in local government or state government even. But I just by happenstance just knew, like, I really don't want to work for a design firm, and just in my gut knew that my calling was bigger than just design and urban design, but that I really wanted to think intersections of planning and health. And I learned in my planning history class, one of my first classes in the planning program, that the need for urban planning was really born out of public health and the need for us in early days of American city development to guarantee that people were living in safe and healthy conditions. And so then from that was born design. So definitely not a direct path into the field. And throughout the program, people would often look at me like, now what do you want to do? Why are you studying design? But it certainly has proven exceptionally valuable in the work that I do every day. And in my career at the university, I've done a number of things. I'm university president. I've worked in our planning and real estate areas and worked on some development projects. About 10 years ago, we started a place-based revitalization project around one of our community hospitals. And I had the opportunity to come over and lead that work. And so that really was my entrance into directly working in community development and healthcare together. And I haven't looked back, and there's so many different experiences that I've had through this journey on the Near East side of Columbus that, are just invaluable. And it really is a pathway for us as a health system to be investing in social determinants and health equity work very intentionally in a place. So.
Well, thank you for sharing. Most of us don't have a straight course, right? I think growing up, we think, oh, I'm going to go to school and I'm going to graduate and I'm going to do this and I'm going to get this job. And,
Yep.
We're going to work at the job for 30 years and then we're going to retire and maybe have, a spouse and some kids along the way. But as we grow up, we learn this route is all the way around. But as you said, everything happens for a reason and we are where we are supposed to be. So, and speaking of being where you're supposed to be and talking about place matters, right? I would like you to tell our listeners a little bit about what that phrase means when we talk about um, urban development, and maybe even give us a little bit of history about how urban areas were planned, say, 50, 60, 70 years ago, and how that's influencing some of the health outcomes we're seeing today.
Absolutely. So there are many ways to approach revitalization and improving places. I happen to believe that place-based and being focused in a very hyper-local way is the best way. You're thinking about a specific population, you want to focus on where they're experiencing their life every day. So I think today in 2020, it's pretty common knowledge that health is impacted by more than healthcare. It's more than, do you have a primary care provider that you see regularly, and are you managing disease well? It is all about where you live, where you work, if you have opportunity for economic mobility. We think about our work. So the project that I alluded to that we started about 10 years ago is really a nonprofit. So the medical center founded a nonprofit that's focused on creating a mixed income community of choice. And what that means for us is that the young people who are growing up in that neighborhood are happy and healthy and have opportunity to pursue their life, right? And that's really what total health and well-being is about. If you think about kind of the history of our country, which you have to plan in context. So, in 1933, there was FHA policy that we summarize pretty commonly now as redlining, that essentially kept Black Americans out of growing suburbs. So suburbs were evolving. There was a housing shortage in the urban core. And so we started building highways out into communities of opportunity. And there were some people in our society that were left behind. And that was Black America, right? And so even as that policy persisted and we saw all these nice new planned communities popping up on the edges of our urban core, what we found is that segregation has had lasting impacts. FHA and the Federal Reserve Bank have attempted to repair that through the Community Reinvestment Act, which was authorized in like 1977, 1978. So within a short period of time, we realized that policy was a mistake as a society. And so in trying to repair that, CRA was passed, so Community Reinvestment Act was passed, which essentially was calling upon banks to help correct some of the ills, right? And so banks were called to open new branches in these urban areas to loan to low and moderate income communities. But even beyond that, it didn't work, right? We continue to see racial segregation in our communities, and the haves and the have-nots persisted to a point now where, again, there are many scholars and research right now reviewing the wealth gap that we experience, and that wealth gap persists into health outcomes. A scholar of ours at Ohio State studies the impact of racist policies on maternal fetal medicine, for example. And maternal fetal health is just one of those glaring examples. So highly educated Black woman, my health outcomes, I'm more at risk for poor health outcomes as it pertains to infant mortality than a white woman in America who has less than a high school education. That's all the result of these housing policies and all of the things that ensued after them. So as communities were designed, they were designed for white people and they were designed for Black people. And that goes down to everything, it contributes to everything that we think of when we start talking about communities in poverty. What I really think about is, what are the impacts of intergenerational poverty? What happens when you have a family who's living in public housing for multiple generations? And so as we think about solving and resolving some of these societal ills, we have to do that in context. And place matters because it wasn't every place that was left behind. There were certain places that were left behind. And if you are in local government, for example, it's really difficult to make a grand sweeping investment across a large metro area without thinking about how that investment applies to one particular place. So most urban core neighborhoods, so neighborhoods that were, essentially, if you go to Detroit, Minneapolis, Columbus, Ohio, Boston, wherever you are, you can find those communities. They got Martin Luther King Boulevard. They've got the highway splitting the community off of, economic growth. So the Central Business District, for example, here in Columbus. The Near East Side, where I work every day, is split. The highway split the neighborhood off from downtown, which means both symbolically and literally split off from economic opportunity. And so you have to invest, I think, intentionally in repairing that. And that's really why place matters. Again, I can't say it again. Every place wasn't left behind. So we need to go to the places that were left behind. And we also need to look at all of the things that contribute to the homes and the people in particular who are suffering. So we need to look at housing in those communities and education and access to healthcare and transportation and food security. And the list goes on. All of those things contribute to, are we creating opportunities for young people to be happy and healthy and their parents to be employed? But doing that in context is incredibly important. It also builds in accountability. So it's easy to say we made a $10 million housing investment, just kind of sprinkled it across a community. But if you say we're going to do it in this place, you can measure that over time and course correct, which is what we've done over the last 10 years. This is working well. Okay, now we can move on to this new thing, or we need to course correct because this is not having the impact that we intended it to have, or we're not connecting to the people that need us most. So
that makes a lot of sense. And you know, and as you talk and thinking about the neighborhood I grew up in, and you know, I mean, I know about redlining, and I know not very superficially about urban planning, right? But you know, I'm sitting there thinking about my neighborhood and thinking about how that actually looks. And when you grow up in it, you know, you're like, well, this is just the way it is. But I digress a bit. But speaking kind of, you know, we're in this COVID pandemic, which is the state of the world we live in right now. And at the beginning of the pandemic, we talked a lot about essential workers. And that conversation, you know, has spiraled into a lot of things. But one of the things about the essential workers wasn't just the work that they were doing, the neighborhoods they were going back to, and how you're getting back and forth to those neighborhoods, whether you're taking public transportation and that type of thing. And I think, you know, again, not anything new, but, you know, it's just kind of this highlight, this flashlight on the situation that has been there. So talk to us a little bit about how that played out and how the essential workers basically is a surrogate for this conversation.
Absolutely. So I'll touch on a couple things in that regard. And one of them is that a huge part of, I think, my effectiveness in my role is, like you, I grew up in an urban core. And so I think about, you know, when we lived in our communities, we didn't feel lack.
Right.
So I think that's an important piece. And it's the way that we lead our work through PACT is really from an asset-based approach. You know, there are many things that aren't going that well, but there are a lot of assets in the community. And frankly, the people who live there are the experts. They're the expert of their lived experience. They are innovating all day, every day. So, you know, perfect example about that essential worker. They're figuring out, how am I going to get from point A to point B, make sure my kid has what they need, all with very limited resources. And we really have to honor the fact that people are making some really difficult choices every day, but they're navigating and they're working around it, right? So I am so grateful that I grew up in the community that I grew up in. So I'm originally from Toledo, Ohio. And so I grew up in Toledo in the urban core, and again, had no experience of lack. You know, I had a loving community. I mean, grew up going to a community center, my church, I went to the library every day. And so as we think about these places, start thinking about those assets that exist. And those are your partners, right? So, you know, as an anchor institution, Ohio State has a presence in the neighborhood. We're the largest employer in that community, but there are other institutions that have a presence and are fulfilling needs for these families. So libraries are the perfect example, community centers, recreation centers, and you start thinking, well, wait a minute, we have a lot of. So from a planning perspective, before we started our work, I looked at the neighborhood and I mapped how many churches are there, how many schools, how many cultural facilities are there, et cetera, and then backed into that. How are the people in the community leveraging those? So COVID-19 happens to us in our communities, and certainly the biggest kind of reflection that I've had in this season, and it's really shifted a lot of our work. I'm spending a good 80% of my time thinking about specifically how the digital divide is exacerbating and really elevating wealth and race gaps in our community. So our essential workers, which the majority of the folks who live on the Near East Side of Columbus, and I would argue a lot of majority Black and brown communities across the country, are the people who are bagging our groceries at the grocery store. They're bus drivers. They're doing jobs that they cannot easily transfer to working from home with a computer. And so what we saw was, one, all of a sudden, deep gratitude for these employees in a way that, you know, if we're being wholly honest, we didn't value them. And we know we didn't value them as a society because minimum wage is where it is. So that's one piece that really was elevated for us, is that if these people are essential to our lives and our society being able to operate, then their families should have the resources they need to work. It also elevated for us gaps in childcare.
Yes.
So suddenly schools are closed and you're an essential worker. What happens with your children? And where are they going? Childcare is exceptionally expensive. And I say that as a mom of a 3-year-old. It is a second mortgage. And so if you don't have the means to choose where you're sending your child, that also starts putting a tension on your household of what am I going to do with my children? And then the other piece too was their safety and their health. So we're expecting people to keep boarding buses, keep interacting with hundreds of people in the grocery store without a lot of conversation around, you know, let's educate them on why they need to be wearing a mask. Do we or do we not need to be wearing gloves? I don't know about you, but 2020 is like the longest year ever, right? March feels so long ago.
Yeah.
And as the public health knowledge was evolving around how to protect ourselves and stay safe and stay healthy, we had a community of people, particularly our essential workers, who, how are they getting these messages? They're not online all day. Many of them don't have access to the internet and devices in their homes. So for us, this shifted our work. In March, I was working through how we were going to connect and remain a very community engaged organization, and never having thought about the fact that as our society was shifting to being mostly digital, everybody was not able to shift.
Right.
And so we literally started a new strategy where we're exploring how do we close the digital divide by 2025. I'll tell you, the PAC team looked at me like, girl, what? How are we? And I didn't know, and I still don't know. I mean, I know a lot more now, but we're working on affordable and effective internet for every household. We're going to be distributing hundreds of devices to people, laptops and tablets, but we're also measuring it. How is getting this access allowing you to compete and participate in economic opportunity that's lifting your family forward? So having a computer is access to work, health, telehealth, for example, and then also social benefit. So I think there's a dignity piece around closing the digital divide that very closely mirrors redlining. If you look at maps of people who have internet accessibility in their home and those who don't, they're almost parallel to redline maps. So we know in context that 1933 policy has persisted in every dimension of our life. So those are some of my reflections, what I think my role is. And I always say, you know, everybody has a lane to drive in solving some of these problems that we're working towards and achieving health equity. And the lane that I'm driving in is how do we close the digital divide to really give people an opportunity to reach whatever the American dream is for their family. I hope it includes health and well-being strategies to, you know, accessing primary care and continuing education, because maybe you don't want to bag groceries forever. Maybe you might want to start your own small business. And so how do we get you connected? Because our society is only going to get more and more digital. And so if we don't close this divide now, we're going to be leaving more and more people behind. So don't get me starting about digital divide. Colleagues at Ohio State will tell you that, you know, I'm like a dog with a bone with this one, because it really is a utility. I don't believe that access to the internet is a luxury in 2020. It's not. So,
I mean, and you know, one of the things that, you know, I'm hopeful that this podcast is doing is talking about health equity in a broad space. So we mentioned over and over again about health equity not being so focused on the healthcare you receive in the clinic or the hospital. And you touched on a bunch of things. That is what we talk about. We talk about the wealth gap. We talk about the digital divide. We talk about transportation. We talk about access to childcare. And, you know, in talking about those things, we're also talking about poverty and nutrition and all. So these are all intertwined. And I think to your point, you know, we need to work towards not just talking about them individually, but the synergy, the overlap, so that we continue to work together so that we can change them, hopefully simultaneously, to improve
Mhm.
people's lives. I know I have just a little bit more time with you, but I wanted, you know, I try to end a little bit optimistic. And have people tell me what they are looking forward to kind of when we get over the hump, or what do you encourage people to do if they're interested in learning more, doing more to affect, you know, the vulnerable communities in their area?
So I would say, you know, it is the end of September now. We're, you know, just under 60 days to an election. I always tell people the number one way you can engage, and importantly, as a civically minded citizen, clinician, whatever role you find yourself in, is to vote. Voting is, you know, a very powerful tool to really affecting the change that we want to see and affecting the leaders that we put into office at all levels of government. So don't just vote in general election, vote in all elections, because especially as we think about being anti-racist and disrupting these policies, which are essentially racism in policy, it's important that we think about all the nodes along the system. So criminal justice, you're electing judges and prosecutors and et cetera. So voting would be my number one kind of piece of advice. The other piece that I would say is, if you find yourself working in healthcare or in communities, go find your partners in this work. So I'm very fortunate at Ohio State that I have partners in our chair of family and community medicine, which is an alum of the Reed Scholars Program, Dr. Wando Olaiwola. I have partners like Dr. Daryl Gray, another alum of the Reed Scholars, Dr. Joshua Joseph, Dr. Mark Rastetter. I mean, these are my people in my organization, and we're all in different lanes of this work. And I think in order to achieve health equity, you got to find kind of the tools in your toolkit, which are often other colleagues that bring expertise that you don't have. And you guys need to be working together. So if that doesn't exist in your organization, create it. Really look for those partners in this work. This work is hard, and so you also need encouragement and inspiration and really people to help you move along the track. The other thing too is that you can't do this work without directly engaging with the people you're trying to solve problems for.
Yes.
Data is only going to tell you so much. There is nothing, absolutely nothing, and somebody prove me wrong, but I know I'm not wrong. There's nothing that replaces community engagement. And so that proximity and getting close to the people that you're trying to solve problems for is going to make all of your solutions that much better. So you may know that there is this one piece of one missing element in a community that your organization or you can add, but you're only going to add it at the right level if you're talking with the people you're trying to serve. And that's time consuming, but it's always worth it. Your solutions land in a way that you can measure them. And importantly, you build relationship and rapport. I cannot do this work without my partners institutionally, but especially with the people in the community walking alongside me. There is nothing that we do in the community that does not start with community engagement. And I just think that's so important to do. So vote, find your partners in the work, engage the community directly, and speak up. I mean, you know, I think a lot of my experience, and certainly Mary, you may share this, a lot of my experience is excellent in doing this work, but a lot of my expertise in serving urban communities is that I grew up in one.
Yeah.
And so that reflection, nobody can replace that, right? You can't replace, I just know my people, right? In any area code, and I have the great privilege of helping other people across the country do this work too. And wherever I touch down, I kind of know from lived experience too. And so draw on that, you know, bring your full self into this work and you'll surprise yourself. I know I look back and I'm like, man, we've been doing this work on the NERI side for 10 years. Wow, 10 years goes by really fast. So bring your full self and look for those partners and make sure you vote, 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 vote.
Vote, vote. So I'm gonna say that again. Vote, 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 please, y'all. Please vote, please. And I love that. Bring your full self. I mean, like you said, sometimes what we know ourselves the best, and we bring that to work that can help the others that we're build and continue to work together to make all of our communities stronger. So with that, I thank you so much. This was a great conversation. I appreciate you talking with us today.
Thank you so much for having me.
And I'll have to come up to Columbus since all of y'all are there and
Yes,
visit one
we
day.
welcome you. And I welcome more Reed Scholars to Columbus. We got plenty for you to do.
Okay, now watch out. Don't come. All right. Thank you.
Thank you.
Thank you for listening to Reed Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.